It was my first week of clinicals. Within 5 minutes of meeting my patient, his TPN line disconnected and fell on the floor. I had no idea what to do. I completely froze. I was assigned to a patient diagnosed with abdominal cancer, receiving TPN via a central line. I had on my pink and white nursing student uniform. I was nervous, but I was determined. My professor gave me clear instructions. Go in, introduce yourself, conduct an assessment, and report back to me at the end of clinicals. And then she left me in a room alone. So just like any other student, I went in, I introduced myself, I asked my patient to tell me about his day, and then I asked the patient for permission to conduct an abdominal assessment. After receiving permission, I went on to lift up my patient's gown, and as I was doing so, I noticed that the TPN line disconnected from the central line and fell on the floor. I immediately bent down to pick up the line, and now I'm standing there with this line in my hand, dextrose 25%. Sugar is dripping down my hand, running down my arm, leaking to the floor. The floor is sticky, and the patient's eyes are locked in on me, looking as if he's asking the question, does this student know what she's doing? I tell you, my mind went blank. I didn't even remember to turn off the pump. But as I'm standing there, within a few seconds, infection control practices kicked in. So I knew not to reconnect this line. So there I am standing there with this leaking line in my hand, looking like I have no idea what to do. Thankfully, within a few more seconds, a staff nurse walked into the patient's room and saw me standing there and offered to guide me through this process. We proceeded to change the TPN tubing line, cleanse the central line off, and safely reconnect the TPN tubing to the central line. Throughout this process, I tell you, I stayed calm, I stayed teachable, and I stayed focused on learning. And throughout this interaction, I realized that my patient's face became calmer, and he also became more receptive to my teaching. And I think he also knew that I was doing my best to provide safe care. That day taught me this: stay calm even when you don't know what you're doing. Protect patients first, and most importantly, be willing to learn in the moment. Patients can sense when we are confident, and they know when we lack confidence. Even in unexpected situations, how you carry yourself will determine how much these patients will trust you as a student nurse or even as a future graduate nurse. When you go into clinicals tomorrow, this week, next week, I want you to remember this when you enter your patient's room. If something goes wrong, protect the patient first and then ask for help. Confidence isn't about knowing everything. Confidence is about staying composed and making the best decisions for your patients at that particular time. Happy clinicals.